Hello, I'm Dr. Ramsey Asfour, the founder of CapsidConsulting.
And I'm Dr. Dos Sarpel, an associate with CapsidConsulting.
Today we're going to talk briefly about testing directions in COVID-19. So, Dr. Sarpel, can you give us a little bit of background around the concerns in testing for COVID-19?
Sure. So over the last 9 months since the pandemic has hit, a lot of different testing options have been developed. And now, before we only had, one type of tests. Now we have several different types of tests with strengths and weaknesses. And so it can get a little confusing and different tests would depend on the frequency of the frequency of testing people would be dependent on which tests you use, and how valid the test is in certain settings also changes.
Exactly. And now there's many different kinds of tests, as you alluded to. Perhaps walk us through some of the pluses and minuses of different tests.
Sure. So the molecular diagnostic tests are the gold standard. They're the most sensitive tests that we have for SARS CoV-2 virus, which is the virus that causes COVID-19. So for an example, a PCR test is a molecular diagnostic test, and they're very, very sensitive at picking up genetic material. Subsequently, antigen tests have been developed. These detect certain proteins on the SARS CoV-2 virus, and they're very good at picking up an active infection, so someone who may be infectious. And then the lateral flow rapid tests are very quick turnaround tests that you can do at home that don't require another machine, similar to a pregnancy tests. They're not as sensitive as the antigen tests or the molecular diagnostic test. Antibody tests are blood tests, so these tests look to see if someone has developed antibodies, either acute antibodies or long-term antibodies to SARS-CoV-2. Some people have advocated for its use in opening up businesses and company buildings, sort of like a passport idea. If you have antibodies, then you can enter the building. However, the science isn't there yet. We're not really sure how long antibodies last, what level of antibody provides protection. So, the science is still out on that. And then there now is flu testing. So influenza season is coming. And a lot of these companies that have developed these tests have already had influenza tests. And now they're looking at ways to combine the test for COVID-19 and the test for influenza, so you could get all of that in one nasal swab. And those are being developed and slowly being released on the market.
I love that idea of the combination testing for flu and COVID-19 at the same time. This slide shows what might be an at-home lateral flow assay, something like a pregnancy test, but obviously this you would put saliva, I assume, or nasal secretions, depending on the test, in this little dot, right? Tell us what you think about these tests and some of the strengths and weaknesses.
Sure. So all these tests have different costs, turnaround, their availability is different, and obviously the setting you use them is different. The molecular diagnostic tests take take the most manpower and cost the most. The turnaround time is the slowest, although there are molecular tests that can give you turnaround time, in an hour or sometimes less. But a lot of the times, these are the tests that you hear in the news where it's taking 3, 4, 5 days to come back, because sometimes you have to ship it to another site to get it to run. And the availability obviously depends on where you are, but they typically have pretty good availability. Antigen tests have quicker turnaround times. Those are 5 to 15 minutes. They don't cost that much. And they may not be as good as a molecular test, but as I mentioned, they're very good at finding infectious people. And the setting that you would see them in are like urgent care centers or emergency departments, things like that, or other healthcare settings. And then there are the lateral flow tests, like demonstrated here, that are the at-home tests. So they're not as good as the antigen test or a molecular test, but something that's been floating around in the ID world is to not let perfect be the enemy of good. So are these at-home tests perfect? No, they're not, and they're not that sensitive. But they're cheap, maybe $1. You can do them very, very quick. They're easy to interpret. If you have them at home, you can do it, every day or every other day, and it'll be able to detect when you have enough virus to be infectious. And if it's positive, then you can go talk to your primary care doctor, go to an urgent care center, and get that test confirmed. Dr. Mina out of Harvard has been a huge proponent of these at-home tests. You may have seen him in the news. He's been writing in journals, New England Journal of Medicine, and giving a lot of interviews saying, these at-home tests that we can do, every day or every other day is a key way for us to control the pandemic and really open up more, because we'll be able to identify the people that may be infectious.
I think that's super important, is the people that are infectious, identifying them quickly. There's a lot of unique situations and that might be a little bit nuanced, and different ways to approach testing and customized solutions for your particular needs. And we've really thought a lot about COVID testing in nursing homes, in schools, in businesses, in other situations, in hospitals, of course, as well. And so please feel free to reach out to us with any questions. You can get us through our website. Thank you very much for your time, and look forward to a few more videos from us coming soon. Thanks for watching.